Hi again everybody. Today I wanted to talk to you about knocked out teeth. All sorts of accidents can happen where your face plants first and there is a risk that you can knock tooth or teeth out. The first thing to do is to try and keep as calm as possible. Have a look round and try and find the tooth. Don't put it straight back in. What you need to do is try and get that debris off. So give it a rinse in water or milk and try and get it as clean as you can without touching it. And then you can place it back in the socket as before. Now if you can find the tooth and the root is clean, that's perfect. We just need to pop it back into the socket. Holding it by the crown, never hold it by the root, so you're holding it by the bit that's normally sticking out of the gum. So put that back into the socket, ensuring it is the right way round, and then what you need to do is to get them to bite for 15 to 20 minutes on a clean handkerchief or a piece of gauze, rolled up into sort of a pad. But the sooner you can get that tooth back into the socket, the better the outcome will be for the tooth. If the patient is unconscious or you're not confident enough to put the tooth back into the socket, don't. Just put it into some milk or some water and take it with you to either the emergency dentist or the hospital. If the patient is coherent and conscious, they can keep the tooth in their mouth, so they put it between the cheek and the teeth so they can keep it in there. Again, avoid touching the root. The sooner you can get that tooth in the socket, the better the outcome will be. When we talk about children, children obviously we know they bump into things and fall off things. If they lose a baby tooth, don't worry unduly. That tooth is going to be replaced by an adult tooth anyway eventually. So just make sure that there isn't any bits of tooth in there. If you are concerned, I would take them to the dentist. Like I say, it is a rare occurrence. Don't try and replace it in the mouth. You could damage the adult teeth underneath. So just mop them up if they've got damage to the lip or the tongue or the gum. Just try and stop the bleeding. If you know that you are playing contact sport, it's really, really important to wear a mouth guard. And the mouth guards that we would highly recommend are ones that are made by a dentist. Some football, rugby clubs, etc. actually get a dentist to come in and just take impressions of everybody that wants one, and then they can be made for them. If you're getting a mouth guard for a child, it may need to be changed sort of 12 monthly as their mouth develops. But once you're an adult, it will last much longer. So good luck. I hope you never have to use this advice, but you've got it if you need it.